Joe DiMatteo of the Len and Joe Ask the Pharmacist radio broadcast. Thanks for tuning in again with us today. Just a little bit of quick background on Len and myself, both pharmacists, board certified in clinical nutrition, and doctor of naturopathy medicine. Kind of a varied background, gives us a little bit of a handle on the traditional medical approaches, what pharmaceuticals do, how they interact, how they react in your body, but also in pursuant of more alternative, more holistic approaches that we believe are very compatible with thinking today. I don't believe we have to do snake oil type considerations. I believe that we can basically bring you a lot of scientific evidence that supports that more naturopathic, holistic approaches make sense. I think in general the population is looking for this perspective. I'm going to focus today on natural hormone replacement. Now that term is used very loosely. What does natural mean? I went to my doctor. I said I want to do natural hormone replacement. I'm menopausal. I have all of these symptoms. What are those symptoms? Hot flashes, night sweats, vaginal drying, ringing in the ears, maybe hair loss. My skin is dry. My libido is down. I'm suffering more anxiety, depression. I have significant memory loss. These are all symptoms of decline and changes and drops in hormones. So as a menopausal woman, what are my options? Well, I have traditional approaches, which are animal-based synthetic type hormones, or I can do something that is more what we would term physiologically compatible. The FDA doesn't like the term biologically identical or bioidentical. They say there's no such thing. So let's clarify. I don't want to aggravate the FDA, but yet I need to clarify to you what I'm really talking about. Natural, I don't know that I even like that terminology because these are still hormones, what I'm going to talk to you about today. What is physiologically compatible to your body. So let's just say this for the sake of argument. They are compounds or molecules that are absolutely identical to what your body makes. What you use synthetically are little twists. Medical folk and scientists will tell you that they're the same. No, they're not. You can, if I had an hour, I could prove to you why they're not, but I'll give you some quick examples, but they're not the same. Biologically or natural or biologically identical molecules, all that really means, let's not get into semantics, the exact same thing that your body makes. Not close, with a chemistry background, etc., pharmacology. This is horseshoes, and being close doesn't count. You don't get points for that. Either it's the same or it's not. So let's talk about an example. Let's say you were using Premarin, which is an animal-based hormone, orally. A lot of problems with the oral scenario in the oral version, but let's just say you were using Premarin. Premarin is about 80% estrone. To you, that means nothing. Three basic principal female hormones that your body makes. You make estradiol, you make estrone, and you make estriol. Estrone and estradiol are the more powerful hormones, female hormones. You also make testosterone and progesterone, obviously. But those two are very, very powerful. If you look at something like Premarin, Premarin is about 80, and some literature documents 90+% estrone, the most powerful of all three of those estrogens. What does a woman's body make? So when I say compatible, physiologically compatible, biologically identical, what am I really saying? I'm saying just don't reinvent the wheel, just try to reproduce what a woman's body does. So when I say try to reproduce what a woman's body does, that means just put back what she makes. Premarin, for example, is 90+% estrone. Most of the literature shows that a woman only makes about 10 to 15 to maybe max 20% of her total estrogen formulation that she manufactures, 10 to 15%. And you want to take an oral prep that contains, what, 90+% estrone? Not physiologically compatible. Why would we be proponents of this? Well, you just have a financial motive. No, because my wife does it. I recommend it to you folks. I recommend it to my wife. Why? Because I believe, and I know many folks would dispute this comment, that it is a safer option. Why would I say that? I think all hormones need to be treated with respect and needed to be treated carefully. You should be monitored. You should have saliva hormone testing to document exactly what your numbers are. But if you're a woman and you're transitioning through and you're going through menopause and you are suffering from one or all of the above, from anything from hair loss to dry skin to vaginal drying to loss of libido to sleepless nights to night sweats, the list goes on. Pardon me for that. Then you need some help. So you have an option. You either have the traditional route, which is quote-unquote FDA approved. They're synthetic. Most of them are oral. They do not mimic identically what your body produces. And in most cases, they're totally unnatural to you. Why would I say that? Well, let's talk about that. For example, Premarin, just as an example, 90+% estrone, but there's 6-7% of that is equilenin, dihydroequilenin, 9-hydroequilenin, 6-hydroequilenin. What are those compounds? They are hormones that are only seen in equine populations. That's a horse. So I often say if God wanted you to use horse hormones, He would have made you a horse. He'd given you hoofs. You don't have hoofs. You walk on 2 feet as opposed to 4. Then you should be using what is compatible to your body. Traditional manufacturers, the FDA, etc., argues the fact that we can't make claims that they're saying. I'm not making claims. I'm not making claims. I'm saying that if you're going to put something back into your body, why use something that is unnatural? Well, because all the literature supports that there are significant downsides if you do not balance these hormones. And we believe that you should just replicate what your body produces. Some might ask that, well, why would I do that if I feel okay? I don't have hot flashes, I don't have night sweats, I don't have any of those symptoms, so maybe there's not a need. And I would say to you, go for it. If you feel like you're doing well, you don't suffer from any of those symptoms, go for it. You may still want to consider doing a saliva hormone test just to document where you are. Where am I in this cascade? Why would I say that? Because there are other significant downsides that you need to be aware of. If your hormones drop precipitously, certainly within that first 5 years of menopause, you're at a higher risk for bone loss, osteoporosis, a lot of issues with osteoporosis that are related to hormones. And as well, there could be longer-term vaginal health issues, vaginal floor weakness, pelvic floor weakness to be more exact, more incontinence issues, bladder issues, more chronic vaginitis, urinary tract infections that are associated with a drying of that tissue and of that membrane and a thinning of those membranes. So that's a huge potential problem from a functional standpoint. So as we work our way through this, we've talked a little bit about the estrogen side, and what we're advocates of is attempting to duplicate in proportions that we see and we find in literature that would match what your body makes. Nothing more, nothing less. Do saliva hormone testing prior to. Now, why would we do that? Saliva hormone testing prior to would tell us where your numbers are. Is there a perfect number? No, but there are a range of values that we should see as being compatible. That we should see, that we know that a woman at 50 years of age, at 45 years of age, at 55 years of age, there's a typical range of what you should fall within. What we do then, once we make recommendations to an OB-GYN or to a physician that we work with, we then recommend follow-up saliva hormone testing. Why would we do that? To protect you, in essence, because you may find that you're doing very well with very high doses, but we may see on the saliva panel that they're not commensurate, they're not healthy. What I'm going to do is I'm going to stop here. This is part 1 to biologically identical hormones. Len and Joe of the Ask the Pharmacist radio broadcast. Thanks for tuning in. Stay tuned for part 2.